Hello and welcome. You're watching the Trey Hart Learning Channel. My name is Ray Upchurch. I'm a registered nurse. I'm currently working in Texas. And today we're going to be talking about heart failure. Heart failure is particularly close to me, as I used to work in London as a heart failure specialty nurse. Now in Texas, I work in a progressive care unit dealing with many patients that have heart failure and the symptoms of heart failure. So today we're going to talk about heart failure, what its causes are, and just briefly touch into some of the symptoms, but not go too far in that. And hopefully by the end of this video, you'll have an understanding of heart failure and what it is. So first, let's talk about the heart. The heart is an organ that pumps blood through your body. This blood contains oxygen, and the heart pumps through other fluids through your body that contains the minerals that your body needs. Now this oxygen and minerals go to the vital organs such as the heart itself, the lungs, the kidneys, the brain. It also goes through other organs to help them receive the oxygen and the nutrients that you need. It goes throughout your whole body. Sometimes your body doesn't do this as efficiently or as effectively as it should do. The reasons for this vary, but this is a very good explanation of what heart failure is. A definition of heart failure is that it simply is that the heart is failing to push blood through your body effectively and efficiently, which causes the symptoms resulting from the lack of oxygenation and these symptoms, or the lack of removal of certain substances into your kidneys or through your kidneys. So some people ask, how does my doctor know that I have heart failure? Well, when you go to your doctor and talk about your signs and symptoms to him, he'll listen to you, and he may perform or order certain tests to be done either in the office or in a local community hospital. Some of these tests that he may order are what they call BNP, also stands for brain nucleatic peptide, an echocardiogram, which is a view of your heart on a screen. He may order some lung tests to see how your lungs are doing, and he may also order some blood tests to see how your kidneys are doing. Using these tests, he can help determine whether you have the condition of heart failure or not. And some of the symptoms of heart failure are shortness of breath, swelling in your lower legs, feeling dizziness, sometimes feeling like you want to pass out, and there are other symptoms that may be associated. But as you may have noted, that some of these symptoms might sound similar to other diseases and other disease processes. Well, they are. That's why when your doctor listens to you, he performs different tests that also rules out or rules in other diseases or other disease processes. So some people have asked, what causes heart failure and can it be cured? Well, heart failure can be caused by a heart attack. It can be caused by heart blood pressure. It can be caused by what in medical terms they call cardiomyopathy, or is also a disease of the heart muscle. It can be caused by a viral infection. It can be caused by heart valve problems, and it can be caused sometimes by chemotherapy or congenital heart problems. Sometimes we simply don't know what causes heart failure. One of the things about heart failure is that it affects people of all ages, from birth through elderly. Some people assume that it's an elderly person's disease, or that when you become elderly, you automatically have heart failure. That's not necessarily true. While it's more prevalent or more common in people that are older, it doesn't mean that it's just those people that have it. In the United States alone, there's 5 million people that have heart failure. Every year, 550,000 people are diagnosed with heart failure. And these include from babies on to adults. Now, granted, most babies that have heart failure are born with congenital abnormalities, but it may not always be the case. So, some people have asked, can heart failure be cured? Well, when heart failure is caused by an underlying condition, such as hypertension or valve disorders, if those underlying conditions are treated, then your symptoms will go away or be reduced, and your heart muscle will return to an almost normal state or close to normal state. And with this, you can lead a full and productive life. However, in most cases, heart failure is caused by a heart attack, and currently cannot be cured. When you have a heart attack, one part or a small bit of your muscle dies, and that bit of the muscle doesn't regenerate. But over the years, different people, such as the American Heart Association or the British Heart Foundation or other things, have studied how the heart works and what can help the heart and help a person live a full life. And they've discovered that there are certain medications or certain procedures that can help people, such as people that have heart valve diseases, they replace the valves in those hearts. People that have hypertension, they treat the hypertension. The people that have anemia, they treat the anemia. So they found that there's ways that help reduce the symptoms of heart failure. Now, some people have asked, well, how bad is my heart failure? A lot of doctors, whether it's in the States or in Britain or in the world, use a system of determining how bad your heart failure is. It's called the New York Heart Association symptoms. And this is divided into 4 bits. The first bit is where NYHA 1 is one where you come in and you have no symptoms. These symptoms is usually found out that you have heart failure because you've come into your doctor for a completely unrelated condition, and while they're doing it, they also found out that you had heart failure. So this means that you don't have the symptoms such as breathlessness or the swelling in your feet. The NYHA2 means that you have some of the symptoms, but these symptoms are usually associated with movement, usually moderate to heavy movement. Meaning that, if you're taking long walks at one point in time, it wouldn't make you breathless, but now it does. It may be related to heart failure. Of course, there's other things that could cause the same symptoms, but this is one of the ways that they classify NYHA2, is that it causes some of the symptoms of feeling breathless, when you're moving. NYHA3 causes more symptoms. Basically, you're breathless, but you don't have to move much. You also have more often that you have the swelling in your legs. That you notice that the other symptoms are there. But it means that these symptoms are present with very light movement. NYHA4 means that your symptoms such as breathlessness are there even with no movement. Some people find that they can wake up and feel breathless. Or that when they they wake up, they feel breathless, or sometimes that they're breathless even just sitting. So this is what we call an NYHA4. So some people ask, will this get worse? The good news is that with the medications and with the treatment, you can actually live a full and productive life. Sometimes the symptoms, you'll find that in NYHA4, which is New York Heart Association symptoms associated with a stage 4, will improve to be a 3 or a 2 with the appropriate medications and the appropriate treatment, meaning that your symptoms of feeling breathless even when you're not doing anything are suddenly only there when you're doing light movement. So, some people have asked that, does heart failure mean that my heart is dead or that it's dying? Let me assure you, it absolutely does not. It simply means that you have symptoms associated with the heart failing to push the fluid through your body the way it should do. That's why it's called heart failure, because it's failing to push the fluids through your body the way it should do. Some people have also asked what an ejection fraction is. Because one of the things that we use when we determine, or that help us determine whether a person has heart failure, is an ejection fraction. Well, an ejection fraction is the fraction of blood that your heart pumps when it pumps the blood out of the heart into your body. Now, just so you know, a normal ejection fraction is 50 to 70%, meaning anywhere between 50 to 70% of the blood is pumped out of your body at one time. Now, you notice that I didn't say 100. That's because your heart, even when you're very young, does not pump 100% of your blood out in the thing. There's always a little bit of residual in there, whether it's that 30% or the 50%. So, heart failure or ejection fraction that is associated with heart failure is one that's 40% or lower. So there's not much percentage difference between 40 or 50%. It's only 10%. But that 40% will sometimes give the difference between whether a person is feeling breathless or not. Now, some people mistakenly think that as I get older, it's normal for me to feel breathless, or it's normal for me to have heart failure. It is not. If you have any type of breathlessness, if you have any type of swelling, any type of dizziness, feeling faint, any of those symptoms, you should see your doctor. So this is what an ejection fraction is. The fortunate thing is that there's been a lot of studies done that help us treat heart failure and that help us treat its symptoms. In the next sections that I'm going to be talking to you about, I'm going to be talking about some of the symptoms of heart failure and how they're treated and what we can do in our everyday lives. Thank you for listening. This is Ray Upchurch. See you next time.